RSV. It is one of the commonest viruses causing infection in the respiratory tract, and it can be drastic. So approximately 33.8 million of new RSV episodes happen in young children worldwide each year.
Looking forward to have a better understanding of the burden of the disease, and also what kind of impact it has on the parents when their child is going through this kind of a difficult situation.
The case fatality ratio depends on where we are working. It depends on your resources. It depends on the country. So it can range from 0.5 to 7%. It can be much higher in countries with limited resources, including African subcontinent, for example.
The WHO estimated that 33 million of the RSV associated LRTIs were there in less than 5 years of kids, and 3 million got hospitalized, which was a big, huge number.
RSV, one of the most common viruses causing respiratory tract infection, and almost all infants by the age of 2 years they will have this infection. RSV had been discovered on 1956.
Who would be highlighting those aspects, how to make compliance, and without compliance our activity is zero, and nobody wants to lose their effort just because of a simple that the parents could not afford to immunize their babies.
The relation between the cost and the outcome, always what we are looking for. And this is what we call it value-based healthcare.
A 35-weeker presented with a short history of 2 days flu symptoms, cough, reduced feeding, and persistent increasing in the respiratory rate.
Perfusion protein F is the one who really produced the introduction of the virus nuclear into the epithelial cell and produced the severe necrosis of the cell.
The consensus of CIPRO guidelines for the management, for the treatment, for the diagnosis, and everything has been mentioned by Dr. Huda. It is there in our guidelines.
What we should do. We are in the beginning of the season now of the RSV. What we will do for those who finished the previous season, they will take another shots or no? And if yes, why? And if no, why also? So this will be the discussion in the debate.
Less than 12 months, if you're less than 29 weeks, that's 28 weeks plus 6 days plus 24 hours. You get prophylaxis. If you're from above 29 weeks, you're not recommended unless you have chronic lung disease. If you have a 32 weeks to 35 weeks, you're not recommended to have it in the new guidelines.
So all of them are here to help us to see what can we do in UAE to reduce the burden of RSV in our all babies, high risk and the 10 babies.